This is the video recording for IV insertion. I've identified my patient using 2 patient identifiers, and I've assessed the need for the procedure. I've gathered my supplies, I've washed my hands, and I'm applying clean gloves. I'm going to open my IV start kit to get my tourniquet to apply it to the patient's arm. I'm going to apply the tourniquet to the patient's arm, and then I'm going to palpate and locate the vein that I want to use for the IV. I'm going to remove the tourniquet because I do not want to leave it on for a prolonged period of time. I'm going to locate the ChloraPrep, and I'm going to squeeze it to break the little glass ampule inside and release the chlorhexidine solution. I'm going to saturate the little gauze pad at the end of the ChloraPrep, and I'm going to clean the site for 30 seconds from inside to outside, with the inside being where I'm going to insert the needle. While the solution dries, I'm going to organize my supplies. I'm going to release the air from the normal saline flush, and I'm going to attach it to the extension set using caution not to contaminate any of the connections on the connection set or the end of the normal saline flush. I'm going to prime the extension set with normal saline until I see normal saline come out of the end of the extension set, just to ensure that there is no air in the extension set. I'm going to open my IV catheter and loosen the catheter from the needle, and this is just for when I do gain IV access. I don't want to be fumbling with a catheter that might be stuck to the needle. I'm going to reapply my tourniquet, and I'm going to reapply my tourniquet in a way that it's easy to remove with one hand when I need to remove it. I'm going to take my IV, and I'm going to enter the vein at a 15 to 30 degree angle until I see a flash of blood. After I see that flash of blood, I'm going to release the tourniquet and advance the catheter and remove the needle. Once the needle comes off the catheter, it's going to bleed. So I'm going to attach the extension set and occlude the vein above the catheter as quickly as I can, just to avoid as much blood loss as I can. I'm going to pull back. I see a good blood return. I'm going to flush. It flushes beautifully, so I know that I'm inside the vein. I'm going to take an alcohol pad and use it to wick up any excess blood from in between the catheter and the extension set to clean up my site. I can also use alcohol to clean any excess blood to ensure that my tegaderm is going to adhere good. And I'm using the sterile gauze from inside the IV start kit to clean up anything. I'm going to apply my transparent dressing covering 3/4 of the part of the catheter that is sticking out of the skin, the little hub. I'm covering 3/4. And the rationale behind this is if I need to tighten my extension set, I don't have to tear down my whole dressing and put a new dressing on. I can just tighten it if I need to. I'm going to use tape to secure the extension set to the patient's arm. I'm going to put the little alcohol cap on the end of the needle-free port. I'm going to ensure that the little clamp is closed. I'm going to make sure that I date and initial this IV. I'm going to throw my sharps in the sharps. I'm going to throw my other trash in the trash can. Unless it has blood, I will throw it in the biohazard. I'm going to clean up my work area, ensure that my patient's in a comfortable position, lower the bed to the lowest level, make sure they have their call light. And I'm going to remove my gloves, wash my hands, and document my procedure according to my facility's protocol.